Eli Lilly has announced details for its Medicare GLP-1 Bridge Program. This will give eligible Medicare Part D patients access to specific weight loss medications. This program begins July the 1st. We're proud to have Eli Lilly's CEO, David Ricks, join us this morning. David, thanks for coming on the show. My first question is, how much is this going to cost per month?
Yeah, thanks for having me on, Stuart. Exciting news today as we've worked with the Trump administration to now offer our weight loss medications, Foundayo and Zepbound, for $50 a month to consumers. Oh. We've worked closely with the administration to lower the price and increase access for these important medications. And this is a big deal because 20 million eligible seniors can now call their doctor next Wednesday and get access to our medicines, Foundayo and Zepbound. So, big moment. And
let me repeat that, because this is very important for a lot of our viewers. Because $50 a month for weight loss drugs, and 20 million people may get hold of this. That is a very, very big deal. That's a huge increase in the availability of these drugs to a much larger audience. You say it begins July the 1st?
Yeah, that's right, next week. And so so what to do now is you can make an appointment with your doctor to talk to him or her about whether this is a good option for you. And we know, Stuart, it's not just good for those patients who've been seeking these medications or perhaps paying a lot more than $50, but it's good for our country because we know obesity is a chronic disease and drives more than 200 other chronic diseases. It accounts for about 40% of all medical spending. So this will save the government money. It'll save consumers money. It's going to be a big announcement next week, a big moment for many seniors.
Oh, well, thanks for bringing it to us. We appreciate that, sir. Here's another one. Your company's executive vice president says the GLP-1 pill could be approved in China by the end of this year. If that were to happen, that'd be a real big deal, a bonanza for you, wouldn't it, with a market like that?
That's right. Well, we just launched in the U.S. The pill, which we call Foundayo. This is a once-a-day, easy-to-take GLP-1 pill. It's growing rapidly in our country. We've submitted around the world in more than 40 other countries. And China seems to be wanting to expedite it for their citizens. The benefit of this pill, Stuart, is not just the convenience to a consumer. I think everyone has heard about the shots, but how can I make this part of my daily routine? And Foundayo can do that. But the other benefit is we can make a lot of it. We've heard in the past about shortages of these kinds of medicines, and we're building the largest, what we call active ingredient factory in the history of our country in Indiana, which will make Foundayo, and we can ship it around the world, including to the Chinese. So we'd be happy to get that approval and launch as soon as we could in China or any other global market.
Now, I'm sure you know from your own research and your own numbers, but can you tell me how many adults in the United States now take GLP-1 weight loss drugs?
Yeah, it's a lot of numbers get thrown around. Right now, in the United States, it's between 12 and 15 million people use the branded versions that we recommend, either from us or our competitor, and have gone to their doctor. These need to be used under the supervision of a doctor. Of course, we've also seen ads on maybe your program and others and on the internet for knockoffs, some of which can be dangerous and not the real medicine. It's hard to count the number of people who might have pursued that. But just bringing it back to the GLP-1 Bridge Program and the $50 offer from Lilly, I think most people were pursuing those knockoffs because of the cost. And now here, for just $50, there's no reason to not use the real thing. Lilly medicine made in America and made under the supervision of the FDA. So I think that's another good reason this program's launching, is to really eliminate people having to use dangerous and unapproved medicines.
I can see the day when half the population is going to be on weight loss drugs. It's not that far away, I don't think. One last one, if I may. What's the breakdown? Pills versus injections. I take it that most people prefer the pills. Will you confirm that?
I think that is the consumer preference, although the history was we launched with injections first. So there's far more injections sold today than pills for us, but the Foundayo pill is growing extremely rapidly. I would project in the future there'll be a balance and consumers can choose, remembering that the pill is a little less potent than Zepbound, our double-acting GLP-1, but is great for maintenance. So a lot of people use the injection, and then they ask their doctor, well, can I get off this and go to something easier? And the pill can be a great choice for them in that case as well. So Zepbound to Foundayo, or start right on Foundayo, the pill.
One last one, if I may. This is fascinating to me, but one last one, if I may. Did AI have anything to do with your development of the pill?
The original invention was sort of the AI era.
Sure.
But we did use AI in clinical trials, and we're using it at massive scale in that factory I just mentioned, which we're building as we've reshored our supply chain in the last 4 years. And that factory is the most advanced, and it's infused with technology, including AI, to run its processes. So at Lilly, we're using AI in every part of our business, from discovery, manufacturing, to reaching more patients, and AI plays a role in all those steps now. And Foundayo, the pill, was developed before some of that revolution, but in the future you can bet a lot of new medicines from Lilly and the industry will come with the help of AI and technology.
Well, David Ricks, I want to thank you very much for coming on the show and telling us about this program. It's very important to a lot of people, and we appreciate you being here. Thank you, sir.
Great to be with you. Thank you.